Welcome to the SimTech podcast. In this episode, we're diving into the world of AI-driven simulation with a special guest, George from Blackframe AI. Blackframe AI is revolutionizing the way we approach medical simulation, integrating AI to enhance realism, decision-making, and training outcomes. We'll be discussing how their technology is shaping the future of clinical education, the challenges of integrating AI into simulation, and what this means for simulation technicians and educators. Whether you're a SimTech, educator, or just fascinated by the integration of AI into healthcare, this episode is something you won't want to miss. So, let's get into it. Hello and welcome to another podcast at the SimTech podcast. Today we're going to be jumping into our Supplier showcase, and today we've invited George from Blackframe AI. Hello George, good morning.
Hello, good morning. Thank you for having me.
Yeah, good. How are you doing today? You all right?
Yeah, really good. Yeah, feeling fresh.
For those that don't know, then George, do you want to give the unaware of what Blackframe AI is and what your goals are, what you want to do with it?
Yeah, so Blackframe AI is a London-based health med ed tech AI startup. It's our mission to standardize, streamline, and automate assessment and training for clinical skills for the healthcare workforce. And we plan to do that using our Blackframe system, which is composed of a device, so the Blackframe, which is quite literally an aluminium black frame.
So it's like a scaffolding, isn't it? So it's like a scaffolding that kind of builds on the table.
Yeah, exactly. Yeah, sits on top of the table. It's got 3 mounted cameras. It's got a microphone. It's got a computer screen and an LCD touch screen. And how it would work is if you're a student and you want to practice a performance of something, let's say a venipuncture or an APG or an examination of something, then you carry out your performance within the domain of the frame. The frame records it, uploads it to our cloud-based platform, where our AI algorithms analyze the performance and give you feedback based on that.
So does it require Wi-Fi or an internet connection?
So the frame itself requires a Wi-Fi connection. Yeah, that's correct. We've also got a browser-based version which we're pushing out at the moment, which would not require you to have a frame. So you could load the website on your browser, on your laptop, on your phone, and record yourself with your device carrying out your performance. And that would also require a Wi-Fi connection as well. Yeah.
Okay. I mean, there's a fair little bit of tech in there for the non-technical gurus. How hard is it to set up?
It's so speaking as a non-technical guru myself, Rafal is the tech whiz on this project, so I'm very relatively simple-minded when it comes to tech. I would say it's dead easy to set up. So the frame itself, you need to plug it into a power source in the wall, and you need to connect it to Wi-Fi. And the biggest issue we've had setting up frames so far at universities has been the Wi-Fi, and some places it's fine, it just jumps straight on. Others, there's some firewalls in place and things like this, so we do need a little bit of support from IT, but still relatively simple.
I mean, how are you bumping into any barriers dealing with maybe NHS IT departments, because they're very picky who they let on to the Wi-Fi, aren't they?
Yeah, so we haven't yet come across any NHS IT departments, although we do have a trial coming up with Birmingham University's NHS Trust. So that is something for the future. It's mainly been higher education, so universities at the moment, and I think there are similar challenges within departments. Let's put it that way. I've heard.
Does it have to be Wi-Fi? Could it plug it into an Ethernet cable or?
So you can plug it into an Ethernet cable. Yeah, that's definitely an option. You can run it off your phone as well if you want to hotspot from your phone. Yeah.
All right. So it doesn't take a great demand of Wi-Fi then, if you can just use your phone.
I would recommend using it with the Wi-Fi just for speed of connection. That's really in terms of the speed that you get your feedback. So the information obviously has to go from the frame to our servers and to some of the AI servers, and that's quite a lot of work that needs to be done. So if you want a quick response, I'd recommend having it into the Wi-Fi, but it will give you a response if you're on your phone. It will just take a couple more minutes.
What if it disconnected during or afterwards? Would it affect anything?
So as long as you'd start your procedure, you'd stop your procedure. As long as you've stopped your procedure, then that will be saved on the computer that's on the frame. So if it's disconnected after you've stopped it, then it will be the performance will be re-uploaded once you reconnect to the Wi-Fi.
All right. Okay. I mean, what's the goal here? Is it to replace assessors, or is it to work hand in hand with them as a multidisciplinary with AI? And because I suspect you're probably going to still need faculty to make sure that everything is still running. Do you need a technician there to make sure that, or is it the user that comes in and they can just operate it themselves?
Yeah. So I guess, our goal is to improve the quality of service provision from an educational perspective and reduce the cost required to provide that service, and to enable organizations to scale provision of training and assessment without necessarily scaling the costs of providing that. And at the moment, of course, we work in conjunction with faculty, technicians to set the frame up and make sure it's working. In the future, we'd like to see organisations with maybe a few frames, maybe a few laptops and devices set up, and students then more free to train in a self-directed fashion, which I think is what their preference is, and be trained and coached by the AI. What we're seeing on the technical side is really interesting. I'm sure everyone's aware of the huge progress that's being made with AI at the moment, and the early performance of our models has been promising, and I'm really excited to see a version of the frame that's able to coach someone from complete novice to competent performer, without any input from kind of external person. And I think that's a win for students because they have essentially an expert tutor available whenever they need them. And I think it's a win for universities because they have someone who can train their students to an appropriate level without them having to deploy staff to do so, which is another huge thing we're hearing at the moment in terms of limited resources in the public sector.
Yeah. So I had a little bit of a discussion with a few people where we work at the simulation centre, because what we do sometimes is we host exams, so like Moslers and Paces exams, where they're really faculty heavy, lots of different stations throughout. And we was wondering, at some point, do you think AI will be, running these exams? Because when I was speaking to one of the teaching fellows, there was like, actually, there's loads of biases within all these exams where, they've been sitting in the same station for 12 participants, one after another. They're essentially losing the will to live because they're repeating the same thing, and trying to stay consistent is probably really difficult for them. Where actually, if you see that this AI can do it, there's no biases, it's completely fair throughout. The only thing that was kind of our doubts was, are people ready? Do people trust AI enough for these kind of exams yet? Or is it purely like just training and educational purposes at the moment?
Yeah, we're definitely not ready,
Yeah.
and I don't think the technology is ready either yet. You know, we've started analysing the decisions our AI has been making, and we've had some very good early results. Um, there are some improvements that we could make. There are some easy improvements. There are some slightly more difficult improvements. Um, but I think, first of all, the AI needs to perform well enough to be used in a high stakes summative end of year environment. And we're only going to really understand if that's the case if we use it in a training capacity first and foremost. So at the moment, we have frames deployed at 3 medical schools, and they're being used as formative assessment tools. So they're supporting training for students. And that's really just a way of introducing students to the frame, the AI, introducing faculty to the technology, and building up a database for us to start to prove from an evidence perspective that AI can perform at scale. I trained at Barts and London Medical School, and they use each year over 1,000 assessors to assess OSCEs for medical students years 1 to 5, it's a huge number of people. Those people are pulled from the surrounding healthcare, academic communities at a significant opportunity cost of doing so. They could be seeing patients instead, for
Yeah, of
example.
course.
So I think, it's a drain on the public sector at the moment, assessment. And there's an actual cost associated with using assessors in some cases where people are paid £400 to £500 a day to assess performances. And that equates to £10 to £15 per assessment. And with Blackframe, we think we could do it for more like something like £1 per assessment.
Wow,
So,
that's it's quite a difference, isn't it, there?
and when you kind of look at this in the context of what's happening in the public sector at the moment, lack of resource, no money anywhere, I think it's a huge opportunity to, use technology to, like I say, improve the quality of service delivered, so the personalization of education for students, and save money as well.
So we're using this term AI a lot. So when most people think of AI, they might think of something very much like ChatGPT, something like that. Is that the same kind of thing that we're talking about here when you're referring that this is an AI model that Blackframe uses? Is it the same kind of thing?
Yeah, so we're experimenting with a couple of different models at the moment. The huge change in the space over the last few years has been around ChatGPT, which is a frontier model, a large language model. And that's been the real breakthrough in terms of the technology. And we've seen a lot of improvement in performance using large language models compared to other techniques. This isn't my specialist area, so I'm not a machine learning engineer, but we're experimenting with a number of models, and I think we saw with DeepSeek that you don't actually need hundreds of millions of pounds to train these models either. So I think we'll see more of these types of models come into the marketplace, which would be good for us as a company because we can experiment with more of them and hopefully find the one that suits our use case best. So yeah, it's frontier models that we're using at the moment.
Yeah, is it all done through like prompts then? Is that what we're saying? So you've got a task trainer, and because they're speaking as well. It's not just the actions, isn't it? It's the clinician like introduces themselves, and there's even parts where did they mention that they washed their hands? Did they introduce themselves properly? So it's not just the language that the AI is picking up on, but then it's also picking up on the physical aspects of the examination to make sure that's all done right. So is it just literally checking prompts that the persons that put in before it, the tech or whoever's done it, to make sure that they've ticked each one of these boxes as they've gone down in order?
Yeah, so the way the Blackframe system works is that we provide organizations with the tools they need to build their own mark schemes in the
Oh,
system. So, you don't need any technical skills. You can log into the platform and essentially copy your mark scheme into the system. And by doing so, you're right. You are creating a prompt for the AI to look out for, if you like. So, an example of that would be, did they wash their hands? And you'd write your prompt to the AI saying, did the candidate wash their hands? And it would then look out for that in the performance data. At the moment, our AI is only listening to what students are saying. We're experimenting with some vision models, but we don't yet have anything that we've released. So students are narrating their way through their performances. And feedback we've heard is that that's a useful training tool and good for formative assessment, but for our vision for the future of being able to use Blackframe in summative high stakes assessment, where we think the real gains are to be made, we obviously are looking forward to having a vision model that's watching what the student does as well.
mm. Do you think at any point they'll ever respond back to the participant? Because it's a one-way conversation at the moment, isn't it?
Mm. From from watching students use the Blackframe, that's definitely something students would like. I
Yeah.
think they already think that it talks back to them, and they're a little bit disappointed when it doesn't, which is good because it's an opportunity to add a little bit more value for them for us. Um, on the technology side, chatbots are becoming more prevalent and better performing and having natural, fluid conversations. So, I think when we're a little bit further down the line and, we have a proven business model and some investment in a team, then that'll be one of the little avenues that we'll go and explore and see if we can have some simulated patients talking back to the
Yeah.
students.
Have you heard of Converse AI?
I've heard of Converse AI,
Yeah,
yeah.
so we had them on the podcast before, and that's literally what theirs does. So you can imagine putting in prompts, and it's just a conversation between AI and normally like a GP. You can go through. It feels almost like you two come together to make a black Converse. I don't know what you would call it, black frame Converse AI.
Yeah, same
Um,
frame.
yeah. So what kind of uh, stations scenarios are Blackframe doing at the moment? What do you see? What's working really well?
Mm. So my favorite thing of late is a conversation. So it's an assessment of a conversation between a medical student and a person on the street who's dialed 111 and needs advice on giving CPR. And the medical students are giving the advice to the frame as if they were talking to someone on the other end of the phone. And the organisation has built a mark scheme around giving CPR advice. And I just really like that because Blackframe is really good at analysing conversations, and it's quite a novel use. Um, other examples we've seen are SBAR handovers for the nursing students. Something that's really important on the front line when you're in hospital is that you have a good handover, and often, the SBAR format is sometimes forgotten. So, better training in that area, I think, will improve service delivery, and I think Blackframe's perfect for that. Um, so those are two kind of communication examples, and we've seen it used for examinations. So we've put breast mannequin in the domain of the frame, and students have narrated their way through an examination of the breast and kind of picking up the lump and going through the procedure has been really useful and interesting for them. And we've got a few others as well. So an abdomen, a chest, digital rectal exam, obviously venipuncture is kind of the first procedure that we introduced on the Blackframe. I think the thing about it is that, and this is, props to Rafal, who's built a really robust system in that it's easy to build a mark scheme for whatever procedure you want to do. So it's nice in that people can take the platform and be creative with it and build their own solutions. The CPR conversation wasn't something that we thought of. I actually hadn't thought of that until the medical school built it themselves. And I think, it's good that we've got something robust that people can be creative within and solve their own problems with the tools that we provide.
Yeah. Can it handle anything as complex as maybe a full blown simulation with 3 or 4 clinicians around a patient with different people doing A, different people doing B, different people doing a C, that kind of stuff, or does it have a limitation of how many people at the moment?
So at the moment, we're somewhat limited to the dimensions of the frame. It's kind of a meter long and it's going to sit on top of a table. So it can assess anything that's within its domain, and it can
I
assess
see.
conversations around the frame. But if we're thinking of a kind of simulation in a lab, for example, or like a simulated resus bay, then I think what we have at the moment isn't quite big enough to be used in that scenario. Although this is a conversation I've had a number of times with universities who, see what we're offering and think, oh, that would be really useful, for full blown simulation. So, again, when we've proven our concept and we've got a kind of proven business model, got some investment, got a team, then I think that'd be something that we'd be really interested in exploring for sure.
How accurate is it in marking people? Is it 100% all the time, or does it drop a few points here and there?
Yeah, so we've analysed the first 1,500 decisions that AI has made. and the accuracy that we've seen so far is 98%. Now that's a preliminary result. If we're looking at the decisions that it's getting wrong, a significant body of those are as a result of the prompts that have been provided to the AI. These are early mark schemes that we built without a huge amount of thought, really. We were more interested in kind of getting the product out there and seeing if it worked. But there's certainly some fine tuning of the performance that we can do by creating more specific prompts for the AI. It's in some mark schemes, there are some quite general points, like, for example, if you're taking a history and, you might get a mark for doing a systems review. So you might write a prompt saying, did the candidate carry out a systems review? And the performance might have, asked about one system, and the AI might not have given it a grade because they only asked about one system. Well, you can correct that and by writing a more specific prompt saying, did they carry out a systems review of this specific system, for example? So the preliminary results are good. They could definitely be better, and they do need to be better if we want to use it in a high stakes environment. 2 wrong out of 100, it sounds good, but if we're doing 10,000 performances, then there's quite a few students there who are not going to be too happy with the results. So
exactly, because we watched a video. I can't remember what his name it was. It was on YouTube for a little bit of research before the podcast, and it was the breast examination, and again, there was a couple of things that there was an error on it, and people are just so hung up, like, oh, they've made a mistake, and it's almost like they've lost all credibility because of this one mistake. But then it's the old adage, isn't it, where if you're putting rubbish in, you're gonna get rubbish out. But that's something that can evolve over time, isn't it? It doesn't mean that your scenario or the template is perfect first, but it's going to change over time. When you're tightening up, the prompts each time someone goes through it, and eventually you'll end up with this hopefully masterpiece that goes wrong very few times. Does that make sense?
Yeah, definitely. No, I think I think the most important thing is that we've got the components of something that could be really useful, in the sense that we've found a problem space. The burden of clinical skills training and assessment in the public sector. We have a breakthrough technology that's getting better and better, every month. We've got an engineer in Rafale who can solve any problem that needs solving, essentially, and an engaged marketplace. We've pitched to a good number of institutions now, and there's a lot of interest in the project. So there will be mistakes here and there as we go along, of course, but we've got the fundamental components, and I think it's about not being too put off by small mistakes and trying to keep an idea of what the vision here is, what the goal is here for students and institutions. And I think with the right components, we'll get to where we need to go, hopefully.
What type of feedback are you seeing from people that are using it?
Generally overwhelmingly positive. I know I would say that because I'm the CEO of the company, so I'm completely biased. But no, seriously, I've spent a lot of time contacting universities, med schools, nursing schools, and we've had a lot of feedback on emails. People saying, "Oh, this looks really interesting. Looks great. We'd like to find out more." And we've got some frames in use at the moment, and I think the most important thing from the students' perspective is the feedback that it provides them. You kind of see them engaging with the system, and they're not quite sure at first, and they finish their performance and they get that paragraph of feedback on their phone, and there is that moment where their eyes kind of light up, and it's like, oh, this is kind of cool, and that's, I think that's a really important thing from their side. That is not all sunshine and rainbows, though. I think we still have some work to do on, the AI's ability to recognize things like empathy. So we carried out a really interesting test at Warwick with an actor, and we did a com skills scenario, and the actor said all of the words that you would think you would need to say to empathize with the patient, but they weren't quite said in the right tone.
Oh.
And watching the performance as human beings, it felt a little bit off, It's something you can't quite put your finger on it. It's not, it's not a fail, but it's just not quite right. And the AI wasn't quite able to pick up on the tonal difference that I think we expect as humans when, displaying and receiving empathy. But no, that's not to say that it can't do it. There are models out there that are able to, look at things like tone. We just haven't experimented with them in our platform yet, but that's certainly something where there is some improvement to be made.
Yeah, I mean, what about things like body language and stuff then? Can it pick up posture or, active listening, those kind of things?
So active listening, yes, from the conversational analysis, it's able to, recognize if if you're responding appropriately to things being said based on the text, the words that are being said. Is the person asking open questions, closed questions? That's something it can pick up. So there are some more subtle nuances of interactions that the AI is able to recognize. In terms of body language, we're still experimenting with our vision models. So, I only really have anecdotal evidence, and the vision models do seem to work in a clinical context. They are able to pick up, what objects are, how they would be used, and the potential there really is for the model to be able to watch what you're doing and coach you live through your performance. So I experimented with the vision model using venipuncture, and I was testing it a little bit, and I said, "Oh, I've got the needle in, but I've got no flashback. What do I do next?" And the model's able to say, "Oh, it's okay. Just withdraw the needle a little bit, adjust it to one side where you think the vessel will be, and re-advance until you have flashback." In a kind of live coaching type
Wow.
way. And I think, I think that's would be something that'd be really useful for students in that self-directed learning capacity to be coached through a procedure like that by, something that has the, equivalent level of knowledge as an expert. So yeah, it can do some impressive things. It's not quite perfect just yet, but we hope
Yeah.
in the future we're going in the right direction.
Where do you think you'll be in maybe 5 years, or where do you want to be?
Where do we want to be? We want to be, I think in 5 years' time, we'd like to have a good sized team around us. We'd like to have a good presence in the UK market. We'd like to have a good presence in some other regional markets as well, US, Europe, Australia. We're quite set on, building, scaling a business, and we'd like to have a good presence in this new marketplace for training and assessment that will, hopefully start.
Yeah, I mean, it's such an exciting time with AI, and you know, I always think that the students are going to love this. It's right up their alley. How do maybe more mature faculty members deal with this? It's almost like, yeah, we're replacing you with this robot now. I mean, for me, it feels like that's where a lot of your valuable feedback will come in. But again, it's difficult, isn't it? Because I feel like sometimes AI gets a little bit of a hard gig. As soon as you mention AI, some people have already just like, no, it's not for me. It's almost like cheating in some ways, isn't it?
No, definitely. Yeah, no. I mean, I think the times have changed a lot over the last couple of years. I remember talking to people about AI in 2014, 15, and I think people thought you were a little bit crazy if you thought computers were going to be doing, these kinds of highly complex things. But I think with the release of ChatGPT, the kind of tide does seem to be shifting in the direction of people having more belief that now is the time for AI to really start performing and doing useful, value-adding things in society. That's not to say there aren't cynics out there. There definitely are. I've definitely sent a few emails and had a few responses that been along the lines of, sure, don't quite believe that what you're saying is going to happen, but it sounds like a nice idea. There you go,
Yeah.
kind of thing. But the overwhelming majority of people seem to recognise that now is the time to be doing something in AI. And even with Keir Starmer's announcement a couple of weeks ago that we should be, taking on AI in the public sector, it does feel like momentum is building in that direction, and we'll see where it goes. Who knows where it's going to go? But I'm an optimist, so I think we'll go in the positive direction overall.
All right, then maybe the hardest question of them all: how much does it cost?
So at the moment we're offering a 2-week-long free trial to organisations who are interested in using Blackframe to experiment with the system with as faculty and small groups of students, gain some early feedback. And that's using the browser-based version. If organisations are interested in using Blackframe from then onwards, then we're happy to provide it for a period of 4 months, recognising that we still have some work to do on our side, incorporating vision and other things. So we're happy to provide it for 4 months, so a semester, as a kind of paid version of the trial, and for that we're charging £3,000 for access to the browser-based version and £1,000 per frame on top of that. But the question was really around how long is it going to cost when it's working in a finished product. So that we are yet to settle on. I suspect it will be somewhere the business model will look something like offering bundle packages that include subscription to AI services and either renting or buying of frames. And I think that's going to cost somewhere in the region of £50,000 a year for organisations.
Yeah, all right. We're just about out of time there. Anything that you'd like to add, or how can we get in touch with you if people are interested in maybe taking up a free trial?
Yeah, so if anyone's interested, then they can find out more on our website, blackframe.ai. You can see everything there is to see about the company, watch our product demonstration videos, and if anyone's interested in taking on a free trial of Blackframe, then feel free to send me an email, George Ryan448@msn.com. Be happy to chat with anyone who's interested.
Brilliant. Well, I'll put all that contact information in the episode description. So, like you say, hopefully you're going to have a lot of interest, because I know people are already talking about it, but no one really knows what it's all about yet, because, like you say, it feels like we're at the start of something miraculous almost with this AI hype. All right, George. Well, thanks for joining us today. It's been great talking to you, and I hope you all the best with you taking over the world and Skynet and all that.
Yeah, no worries, Craig. Thanks very much for having me. Good to talk to you.
And that's a wrap on this episode of the SimTech podcast. A huge thank you to George from Blackframe AI for joining us and sharing insights into how AI is transforming medical simulation. It's clear that technology like this is pushing the boundaries of realism and improving the training experiences for all healthcare professionals. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your fellow SimTechs and educators. Got a topic or guest you'd love to hear from on the podcast? Reach out, we would love to hear your thoughts. But until next time, keep innovating, keep simulating, and we'll see you on the next episode of the SimTech podcast.